Hello, everyone. I hope you all are doing well. Congratulations on your pregnancies. My name is Michelle, and I am a genetic counselor by training. I work as a clinical science liaison for CBR, or cord blood registry. And I am here today to give you guys a little bit of information about banking cord blood and cord tissue. So when I start talking about cord blood and cord tissue, I like to start off just by explaining a little bit about exactly what it is that we're collecting and storing. So your baby's umbilical cord is made up of tissue and it contains blood, and it really is the leftover blood in the umbilical cord after the baby's born and the piece of the umbilical cord itself that we collect and store at CBR. And the reason lots of families choose to bank cord blood and cord tissue is that they are both very rich sources of stem cells that can be used in medical treatments. And we know that we can get stem cells from other places in our bodies as well. So we all have stem cells that live within our bodies throughout our lifetime. We can find them in our bone marrow. We can find them in our peripheral blood. We can find them even in our adipose tissue, our fat tissue. So we can find stem cells in lots of different places within our bodies, but collecting them from cord blood and cord tissue has a couple of advantages. The first advantage is really that cord blood and cord tissue, it's a lot easier to collect stem cells from cord blood and cord tissue than it is to collect them from some of those other sources that I mentioned. So harvesting bone marrow, collecting stem cells from peripheral blood, collecting stem cells from adipose tissue, those all require an invasive procedure. Which typically means that there's some degree of pain that can come along with that collection. But collecting cord blood and cord tissue is completely safe and completely painless for both mom and for baby. So that's one of the great things. Another great thing is that the stem cells that we collect from cord blood and cord tissue are younger and more pristine stem cells than the ones we've been carrying around in our bodies throughout our lifetimes. They haven't really had the time to be exposed to anything that could potentially reduce the function of the stem cells over time. So they're just a really nice, pristine source of cells. One question that I get a lot about that is actually, okay, great, we're thinking about banking cord blood and cord tissue, but how long can we store it? And what we know about cryopreservation regarding cord blood and cord tissue cells is that as long as we keep them frozen at very, very cold temperatures, so we keep these cells at minus 196 Celsius, so extremely cold, as long as we keep them at that temperature, we can really keep them indefinitely, as long as you want to keep them for your family. When we freeze them, it really freezes the cells in time, so nothing can happen to them. They don't age, they can't be exposed to anything. And then we just thaw them and use them whenever they're needed for a treatment. So the next kind of logical step, or the thing that I get asked is, what can we use these cells for? So stem cells have really been used traditionally for stem cell transplants or bone marrow transplants. And for this type of treatment, the type of stem cell that we need would be the type of stem cell that we get from cord blood. So this type of stem cell is used very commonly for bone marrow transplants. And there are over 80 different diseases that can be treated with a stem cell transplant. So these are conditions like blood disorders such as sickle cell anemia or beta thalassemia, certain types of immune system disorders, certain types of cancers like leukemia and lymphoma, but also a handful of other solid tumors. And then also a group of rare inherited metabolic disorders. So if you'd like to see that full list of conditions that can be treated with stem cell transplants, you can find it on our website, which is cordblood.com. And you can see all the different types of conditions that can be treated with a stem cell transplant using cord blood. Now, in addition to this sort of traditional use of stem cells in transplant medicine, we also know that we can use cord blood and cord tissue for a lot of research going on in an area of medicine called regenerative medicine. And regenerative medicine is kind of this umbrella term that encompasses several different types of therapies that are being investigated, but kind of the overarching theme of regenerative medicine is that you are trying to use the cells at various cell types to kind of help the body heal itself. And so we can use both cord blood and cord tissue in some of these types of therapies that are being investigated in regenerative medicine. For example, one condition that has been investigated in regenerative medicine using cord blood is cerebral palsy. So for those of you who aren't familiar with cerebral palsy, it is a condition that is typically caused by an injury to the brain due to lack of oxygen. It can be caused by an in utero stroke or some difficulties during the birthing process. And basically, it can lead to movement impairment or motor impairment, along with some other symptoms. And researchers have been looking into using cord blood to treat cerebral palsy for several years now. And we have some early but promising data showing that patients who receive their own cord blood for cerebral palsy have had motor improvements within these research studies. So we definitely still need more data on this before this would be a widely used treatment, but it's just an example of some of the conditions that are being investigated. As far as cord tissue goes, we're also seeing a lot of research with that in regenerative medicine. We know that the cells that we get from the cord tissue, they're a little bit different. So they're a different type of stem cell than what we get from cord blood. And this particular type of stem cell is very good at modulating or controlling the immune system and reducing inflammation within the body. And because of that, there's a lot of interest in using this particular type of cell that we get from the cord tissue for autoimmune diseases, conditions where inflammation is kind of part of the disease process or causes part of the problem. But there's also a lot of recent interest in using this particular type of stem cell for treating the lung condition that's associated with COVID-19. So when someone has COVID-19, we know that their immune system can kind of overreact while it's trying to battle the virus. And part of that can actually cause damage to the lungs, which can lead to a severe condition called acute respiratory distress syndrome. And researchers have been looking at using cells from cord blood and cord tissue to treat acute respiratory distress syndrome for about a decade. And now that we know that this can be something that's caused by COVID-19, there's a lot of interest in using the cord tissue stem cells to treat COVID-19. So there have been a couple of early stage studies looking at this so far. We are seeing a trend in these very early studies and case reports toward better survival rates and faster recovery time. But again, these are early stage studies and we still need to confirm that with larger trials. One interesting thing about CBR is that we are actually getting involved in this research with COVID-19. So we have a partnership with a company called NantQuest, where we will be doing a clinical trial using donated cord tissue samples. So not the ones stored by our families, but donated samples to treat critically ill COVID-19 patients. So just a really interesting opportunity to be able to help treat these patients, but also really opens the door for a lot more research using these cord tissue cells. So in general, you know, there are many, many more conditions that are being investigated in regenerative medicine. There are over 500 different clinical trials that are going on. And, you know, the research is kind of at different stages for different conditions that are being investigated. So I would definitely encourage you to kind of check out our website. You can see more examples of conditions that are being investigated. There are stories from some CBR clients who have used their stem cells for some of these experimental applications, and you can sort of hear straight from them sort of what that experience was and what it was like and what it's done for those children. So really encourage you to check out the website to see that. Now that we've talked a little bit about how stem cells are used, I kind of want to answer some of the logistical questions that come along with this and questions that we get pretty often. And I think I've seen some of these coming in through the comments. So hopefully I'll address most of them. One of the common questions I get is sort of who can use the baby's cord blood and cord tissue samples. And I feel like there's a lot of misinformation out there about this, and hopefully I can help clear some of that up. So when we think about the cord blood sample, especially when we're using it for kind of those traditional treatments with a stem cell transplant, one of the factors that determines who can use a sample is actually how close of an immune system match you are to that person. So basically, if you think about someone who needs an organ transplant, like a kidney transplant or a lung transplant, something like that, you may have heard that we have to find a matching kidney or a matching lung before we can do that organ transplant. And the same is true for cord blood. We need a matching cord blood unit to be able to do it. And what we're referring to when we say matching is actually an immune system match. So your immune system job is to sort of recognize things that don't belong in the body and reject them to protect the body. And so we have to find a cord blood sample that is a close enough immune system match that it can be used. And that is really the limiting factor for who can use the cord blood sample. So the basics of that are that the full siblings of the baby are very likely to be able to use the cord blood sample. There's a 75% chance that full siblings are going to be a close enough immune system match to be able to use it. The baby's always a perfect genetic match to their own cord blood. However, some of the conditions that are treated with a stem cell transplant are genetic or hereditary, and in those cases, we would not be able to use the baby's own cord blood to treat them, because if it's a genetic condition, the stem cells also have that genetic mutation, and it wouldn't help to use their own cord blood. So for genetic conditions, we wouldn't use babies on cord blood. And then biological parents are also always a close enough match to potentially be able to use the cord blood. However, the limiting factor for that is really the size of the collection, or how many stem cells we collect, and would it be enough to treat an adult. So that's kind of the deal with cord blood, mostly for the immediate family. Cord tissue gives us a little more flexibility. So these cells in the cord tissue are what we call immunoprivileged, which basically means that the immune system doesn't they fly under the radar of the immune system a little bit. And because of that, we can actually use these cells for any family member out to a second degree relative potentially. So that's going to include that immediate family, but also half siblings, which I get asked about a lot, would be considered a second degree relative. Also grandparents, aunts and uncles, and then the baby's eventual children, grandchildren, nieces, nephews. Those are all second degree relatives. So a lot more flexibility with that for potentially who could use it. The other question that I get pretty common along with that previous question is how many times can we use the sample? For cord blood, this is pretty straightforward. It is a finite resource. We only get how much we get at the collection. And while there are people working on technology to be able to expand or grow those cells a little more, we're not quite there yet. So we kind of get what we get with cord blood. And typically, regardless of which cord blood bank you store with, there are several cord blood banks out there that you can choose from. But we all end up storing the same amount of stem cells. So it's 25 milliliters of stem cells. And that is typically going to give us enough to do 1, maybe 2 treatments. So it doesn't matter who you bank with, the answer is the same. 1, maybe 2 treatments currently with the technology that we have is what you're going to get out of a cord blood collection. And that's really going to depend on the size of the person being treated, the type of treatment that we're doing, and again, just the size of the collection that we get. So 1 to 2 treatments with cord blood. Those cells in cord tissue, again, have an advantage here. We can actually make lots of copies of these cells, so we can get multiple treatments out of a cord tissue unit when we're able to use those clinically. So hopefully that answers some of the questions about sort of who can use it and how many uses you're going to get. The next couple of questions are usually about logistics. Okay, this sounds interesting. How do I enroll? What's the cost? All that good stuff. So the way that you would enroll if you are interested in banking with CBR is that you can actually just log on to our website, which is cordblood.com, or you can call us at 888-CORD-BLOOD and speak to someone about enrolling with us. It's a pretty simple process. After you enroll, we would send a collection kit straight to your house. And then you would just need to store that kit at room temperature. You don't need to do anything special with it once you get it. Just remember to take it with you to the hospital or the birthing center, or have it handy if you're doing a home birth, so that you can give it to your provider to do the collection. And then once you take the kit with you, give it to your provider, they will perform the collection. So your doctor or your midwife will perform the collection. Most doctors and midwives are very familiar with how to do a cord blood collection, but if they aren't, it's a very easy process and there are instructions in every single kit. So no worries if that's the case, but most of your providers definitely have done a cord blood collection before, so no need to worry about that. After the doctor performs the collection and baby has been born and you're kind of recovering, your providers or probably a nurse will give the kit back to you. You will then call the medical courier. There's a phone number on the outside of the box. So you just call a medical courier. They will ask kind of what room you're in, what hospital you're at, all that good stuff. And they will come to you and pick up the kit. And we want you to make that phone call sometime between, around 2 to 4 hours after delivery. So as soon as you can after delivery, but definitely we want to give you time to get settled a little bit. This is also a really great job for your partner, your support person. Give them the responsibility of calling the courier to have them come pick up the kit. Once the courier gets the kit, they will transport it back to our facility. Our laboratory and storage facility is in Tucson, Arizona. This is kind of a great place to keep stem cells, even though it's hot in the desert and we're freezing everything, because Tucson is historically free of natural disasters. Things like tornadoes, earthquakes, hurricanes are, going to be incredibly rare in Tucson. So it's a nice, safe place to store things. Additionally, we have taken lots of precautions to kind of keep the cells as safe as possible. We have a backup generator. We have 2 9,000-gallon liquid nitrogen tanks. Liquid nitrogen is what we use to keep the cells frozen. There's lots of great little details to learn about our lab. On our website, there is actually a little video for a lab tour where you can learn some more facts about our lab if you'd like to do that as well. And then once we receive the cells, we're going to process them and freeze them. We do always issue a report to let you know kind of the status of the cells, how many cells are present, all of that good stuff once we receive it and run our testing. And then we will just keep them nice and safe and frozen until you need them. Once you need the cells for a treatment, all you have to do is call us and let us know, or have your treating physician call us and let us know that they would like to use the sample, or they're thinking about using the sample for a treatment. And we have a transplant team and a group of genetic counselors who will help coordinate all of that for you guys. We would release the sample to the treating facility. And then it could be used for either an approved therapy, so a stem cell transplant, or an appropriately regulated clinical trial within regenerative medicine. Let's see. So hopefully that kind of explains most about the process. The other question I get a lot, and I've seen a couple of you ask this in the comments, is about delayed cord clamping. What if you want to do delayed cord clamping? Can you still do cord blood banking? Yes, you can in most cases. So there are options for almost everyone. For those of you who aren't familiar with delayed cord clamping yet, I'm sure you will be soon. So the way that delayed cord clamping works is really after baby is born, the umbilical cord is going to be clamped and cut. After the cord is cut, baby separated from the placenta, that is when we start a cord blood collection. So some parents like to wait for a certain amount of time to let some of the blood flow from the placenta back into the baby. And the longer that you wait, the less blood is going to be left over to collect and store at CBR. So there is kind of a balance that needs to be achieved. Most of your OBGYNs are going to recommend somewhere between a 30 to 60 second delay for cord clamping. And that length of a delay is not going to significantly impact your cord blood collection. So you can do both if you plan to do a delay of 30 to 60 seconds. For those of you who want to do a longer delay, longer than about 2 minutes or so, there's probably not going to be enough blood left over to collect, but you do still have the option to bank just the cord tissue. You don't have to bank both of them. You can choose just one or the other. So if you want to do a longer delay and there's not going to be any cord blood left to store, you do still have the option to bank cord tissue. So like I said, almost everybody has an option to make sure that you have a resource of newborn stem cells available to your family. Let's see, I think that's most of the information except, of course, pricing, but I want to just take a quick look and see at some of these questions. I saw a good question come in that I want to make sure I answer. So we did have I do see a question here about what's the oldest kiddo that their own stem cells have helped. pretty recently, we released a sample that had been in storage for 17 years. And that sample went to be used for not the baby themselves, but their sibling who had been diagnosed with autism. So I mentioned that there's a lot of research going on with cerebral palsy. The same group that's doing a lot of that research at Duke University also has done quite a bit of research with autism and using cord blood to treat autism. And so they have what's called an expanded access protocol, where as long as you have your own cord blood or a sibling cord blood unit available, you can go to Duke and be treated for a handful of conditions that are related to neurological conditions of brain injury. So cerebral palsy, autism, hydrocephalus, anoxia, and apraxia of speech. So all of those kinds of things, you can go to Duke for that type of treatment, as long as you have your own cord blood sample or a sibling cord blood sample available. So that's our most recent kind of release that's been stored for a long time. Okay, so I want to just wrap up here with some pricing information. I know this is kind of the big question that everybody has. What we can offer you guys for pricing is actually a really, really great discounted price. So if you go to our website or call us, you want to use the promo code VXTG. I think we'll put that in the comments here as well. But that promo code VXTG, which is good through May 9th, will give you pricing of $760 for cord blood only. That includes everything for the first year. So the processing fee, the first year of storage, everything's included in that $760 price. And then for those of you who want to do cord blood and cord tissue, the VXTG code would give you a price of $1,415, all included. So that is great pricing. Really, for cord blood and cord tissue together is typically the price that we do for cord blood only. So it's a really, really good discount for you guys. I hope you'll take advantage of it. Again, that code is good through May 9th. And then the other piece to know about that is that this is the first year fee. There is a once per year storage fee starting in year 2, and that annual cost is $185 per sample. So for just cord blood or just cord tissue, you would pay $185. And if you do both samples, cord blood and cord tissue, your annual fee would be $370, and once per year for those storage fees. So the prices I gave you, VXTG, $760 for cord blood only, $1,415 for cord blood and cord tissue. That will cover everything for the first year, and then storage fees starting in year 2. All right, so I know we're kind of getting short on time here. Hopefully this is a good introduction to cord blood banking and gave you some useful information about it. We do have our booth open. Cindy is going to be in the CBR booth right after this presentation. I'll probably stop by for a few minutes as well. If you have any additional questions that you'd like to ask us one-on-one, we are more than happy to help. Thank you guys so much, and congratulations again.